In this video, you're going to learn what ibuprofen does to your blood pressure. Now, this may shock you, but stay to the end because I'm going to give you some solutions on what to do instead. My name is Dr. Story. I've been a chiropractor for over 26 years, and I'm going to give you realistic advice based on my experience and based on the literature. This is advice that I give to my patients in office, and if you like this type of video, give me a thumbs up, subscribe to the channel, hit the bell for notification. So let's get into it. Now, if you already have high blood pressure, but you have a lot of musculoskeletal pain, should you be taking ibuprofen? According to WebMD, the answer is no. Now, I realize WebMD isn't the be-all, end-all, but I'm going to put the references down below. I'm going to put some other references as well from other reputable sources, and that'll be down in the description. The question is why? What's the mechanism by how this works? Ibuprofen damages the kidneys, and the kidneys are very, very important in helping fluid retention in our body. And if the kidneys can't do their job, then our body starts to form a problem where there's too much fluid, there's too much extracellular fluid. So now, if you can't eliminate that fluid, all that, it's like too much water in a fire hose. All of a sudden, that will increase your blood pressure. So the problem is, if you have joint pain and you have swelling, but you're on blood pressure medications and you have high blood pressure, what the heck do you do? Is there an alternative solution? The answer is yes. Here's the solution. Non-weight-bearing, light range of motion exercise. And I know that's a lot that I just said, but I'm going to explain it to you. Movement is the best way to reduce inflammation. Let's take a wrist, for example. If I have swelling in my wrist and it really hurts, one of the best things you can do is gently move the wrist back and forth. There are sensory nerves in the joints of the wrist, and when you have light, gentle movement, it actually stimulates those sensory nerves. Those nerves then go up to the brain through our spinal cord, and then our brain senses, that's why they're called sensory nerves, but our brain senses what's going on in this environment here, and it'll actually send motor impulses down to the muscles in the area to actually relax. That's one mechanism by which movement reduces swelling and pain. The second is that gentle movement then allows a pumping action like this to get that fluid out of there. So if it starts to swell and get bigger and you do light movements like that, then the fluid will move in and out of the joint and can be dispersed. As a result, you end up having less pain, less stiffness, and less discomfort. Now, some joints are tricky. The wrist is easy because you simply are not weight-bearing if you're doing it like this. An elbow is easier, it's not weight-bearing. But when it comes to a knee, when it comes to the spine, it's very difficult to do non-weight-bearing. In this example right here, I'm doing a cat-camel type of exercise. If I were to try to do this standing, there would be too much pressure on my spine. But when you're on all fours like this, what ends up happening is it's not weight-bearing. There's no pressure on your spine. On joints like the knee, what I'm going to do is I'm going to put a link right here that shows you exactly how to decompress the knee, do a short range of motion exercise to stimulate those sensory nerves and get swelling out of your knee naturally without any drugs. Then the second video, if that's your knee problem, then watch that video. If you have a shoulder problem, then I'm going to put a link right here, a big square. You can hit that video and watch that and learn how to do this on your shoulder.